Hey, it's Jessica DaMassa with WTF Health, and joining me right now I have Russ Glass. He is the CEO of Ginger. So Russ, good to have you with us.
Thanks for having me.
All right, so you guys are in this behavioral health, on the phone delivery space. What's the secret sauce over at Ginger? What are you guys doing that's different? Because this space is getting awfully crowded, but winners are starting to emerge or rise to the top here. Ginger is definitely among them. What do you guys have that's so special?
I think the biggest difference is our focus on this huge supply-demand balance that we see in the behavioral health space.
All right, say more about that.
Far more people need care than there are providers to get access to care. So they're out there trying to find people to serve them, and they can't get access to it. And Ginger has designed a system that is trying to solve that supply-demand imbalance. And we do it by delivery on mobile device. We do it starting with these amazing behavioral health coaches that are available 24/7, 365 days a year. And then instead of referring out to therapy and psychiatry like most networks, we bring therapy and psychiatry into the care team to solve the level of need that our members have.
Okay, and this is working because you guys have received some significant investment here. I mean, where are you guys at today? 70 million, was it?
About 70 million, a little more actually than 70 million raised to date, yeah.
Okay, and you recently closed a follow-on round. Tell me a little bit about that.
So we recently closed our Series C, and at the back side of our Series C, a wonderful firm called Health Velocity Capital came in.
Okay.
Marty Felsenthal and Saurabh, just an amazing group that's been investing in health tech since the mid-90s. You know, the sort of grandfather, I don't know if they'd like to be called the grandfathers, but they're kind of
Don't call them that.
Yeah, they're kind of exactly. They're kind of the grandfathers of the space. Saw what we were doing and said that they think this is the model for behavioral health for the future, and they want to be behind it.
What do they say was most compelling about it? If this is the model of behavioral health for the future, is it the fact that you guys are using behavioral health coaches instead of more high-cost practitioners? I mean, what was the thing for them that they really looked at you guys and were like, yes, this is the one to put the money in?
A few things. Number one was team. They think we've assembled, and I think, very, as modestly as I can say it, I think they're right. I think we've put together a world-class team that is extremely experienced. We've done these kinds of things before to go execute against it. So that's one. I think two is the fact that we already have over 60 enterprise clients that we're proven with. We're seeing engagement rates north of 10%. We're seeing that members who use us rate us over 4.6 out of 5 across every single session. And importantly, we're getting them healthier at 4 times the rate of the standard of care. And so when you combine all those things, they look at the model and see how scalable and gross margin profitable it can be and say, this is it. This is how we're going to change behavioral health care.
I want to talk a little bit about some of those utilization numbers. And I want you to give me a sense of what are you seeing from your side of the data stream on this? What are people using Ginger for? Is it for depression, anxiety? What is the most commonly used, patient condition or gripe or whatever? I don't have the right terminology here, but what is the most what is the most common issue that people are seeking care through Ginger for?
So one of the unique things about Ginger is that we're getting people earlier. We want not just the people who have a diagnosis, we want anybody who's feeling a little anxious, a little stressed, they're starting to get some concerns about, they might be feeling a little depressed. We want them to start chatting. We want them to start talking to our behavioral health coaches, because one of our core beliefs is our system is not designed to help people soon enough. It's designed to help people once they're really sick. And so that's number one, is we're getting people earlier. So a lot of people are using us for those things. But then if people do need a higher level of care, we want to be there for them. And that's when we'll bring a therapist into the care team. We'll bring a psychiatrist into the care team if medication management's needed. And they're using it for all kinds of things, all the way to very serious illness. As long as it doesn't require inpatient support, Ginger can handle it across 50 states, and we're actually providing our platform in 19 countries around the world right now.
Can you give us a sense of what people are using you guys for most? Is it more of that, I'm not at a diagnosis yet, I just want to talk to somebody and feel this out? Or is it more post-diagnosis? Can you give us a breakdown a little bit? Or
Right. So Russ, answer the question I asked you. Yeah. So
I wasn't going to say that, but basically.
Right, but basically, yeah. So sure, 90% of the population we serve comes in and they have what we would call subclinical needs. They're anxious. They're worried about a presentation. They can't sleep. They are feeling a little depressed. They are wanting emotional support. 10% of the population has something more serious that they need to talk to somebody about. And that tends to be anxiety-driven, depression-driven, and we have some diagnoses that we work on, like bipolar issues and others on top of that. But that's basically how it breaks down.
No, and I love that. Honestly, I'm not pushing for any reason other than to say I feel like that's a really underserved part of the market, and I think that it's amazing that you guys have figured out a way to reach that part of the market and with such a solution that is so accessible.
Yeah, no, totally. And don't, I mean, no offense. My wife says I don't listen very well either, so this is very, I'm used to this.
I love it. Let me beat you up some more then. So what's next for you guys as you look to scale? I mean, because like we said when we opened up here, I mean, this space is getting very competitive. I mean, I think that especially with our behavioral health crisis, as it's kind of been unfolding over the last year and a half in terms of being in the national spotlight as far as an issue in healthcare in America, and even abroad, actually. And you said you guys are in 19 countries now. So, I mean, what do you see as next as you're looking to scale? You're at a point right now that, not very many digital health startups are at, where you're at a C with a follow-on. Yeah. You've got some cash to go and grow and expand. You've got some big contracts. You've got some traction. You've got some numbers. So what's next?
So first of all, the mission for us is a world where mental health is never an obstacle. And we're laser focused on accomplishing that mission. So it's continuing to scale is a big part of this. It's how do we continue to serve more and more people while keeping costs constant and keeping quality constant is the entire focus of the mission. Because if you think about a supply-demand imbalance, ton of demand, and the demand's increasing. We're seeing depression rates go up, suicidality rates go up, anxiety rates go up, and yet the number of providers going into the space is going down.
Yeah.
So this is going to be worse over the next decades. So with that kind of a problem, we need to solve for the supply side. And that's what we're laser focused on doing, both through technology, artificial intelligence, machine learning, through product that delivers smartly, and then a collaborative care environment that gets people to the right level of care, not too much care, but enough care to make sure that they're not getting sicker.
Okay, so you're tackling the supply side. I have the most important question of all for you.
Yeah.
And those out there are watching are probably thinking this, and you're wondering, how have I not asked this up until this point? What happened to the IO in Ginger IO? Where did that go? What happened? It's like all of a sudden we woke up one day and then that's it. You're just Ginger now. What happened? You're like Cher. You just lost your last name.
Yeah, that's right. Well, you can find it still. If you look at our legal agreements, there is still an IO on the legal agreements.
All right.
Simply, we decided that the .io, the Ginger IO, for our members wasn't meaningful.
Okay.
Right? So they're like, well, what does that mean? What does the IO mean? And Ginger, the reason for the company name is that Ginger in Eastern medicine is a preventative medicine. So you take it if you're feeling sick. As a preventative behavioral healthcare company, it's a really great name.
I love it.
The IO kind of made it not as great.
Yeah, maybe it's not more techie. Now it just has a nice zingy,
exactly.
like healing feel to it. I love it. No, I'm teasing you, but I mean, truly, it was like one of those, where did this go? All of a sudden, is this a different company?
We still have Ginger IO stickers and coffee mugs, and we'll get you one.
Got to get rid of those. Thanks a lot. Thanks a lot, Russ. I appreciate that. All right. Well, thank you so much for stopping by. It's a pleasure to hear where you guys are at. Best of luck as you're moving forward, working on the supply side of behavioral health. Awesome.
Thank you.
Big task. Good luck. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.